my name's Janice. I'll be your nurse practitioner today. And you're Todd?
Yes.
Todd, what brings you in today?
I've got a sore throat, and I've got a lot of congestion and a runny nose, and real itchy, irritated eyes.
Okay, and when did this start? A month ago, you said?
It's gotten worse for the last month, but it's been on and off for about 4 or 5 months.
And when is it worse? In the morning? Is it constant? In the afternoon?
It's bad in the mornings, and then it kind of dulls out during the day, and then gets worse in the evenings again.
Okay. How would you describe your throat pain?
It's kind of scratchy feeling, but sore. Worse in the mornings, like I said.
Is it worse when you swallow?
Yes. Yeah.
And then how about your itchy eyes? Is that all the time?
No, it's bad in the mornings when I get up again, and I feel like I just want to scratch my eyes, and it gets better during the day, and then in the evenings it comes back again.
Are there any secretions coming from your eyes?
A little bit, but not much.
Okay, they're just watery?
Yeah.
And then is your nose, is it like a yellow mucus coming? Is it clear?
It's clear.
Any problems with nosebleeds?
No bleeding.
Do you have fullness in your ears? Are your ears bothering you at all?
No, congestion, but kind of in my nose area, not so much in my ears.
And then on a scale of 1 to 10, 10 being the worst, how would you rate your pain?
It's not unbearable, so I would say it's probably like a 5 or a 6.
And would that be for your throat or your?
Yeah, my throat.
And then what helps you with your symptoms? Have you taken any medications?
Ibuprofen helps a little bit in the mornings. I'll take Benadryl occasionally, but not every day, and it helps a little bit, but I've noticed in the last month it's not helping as much.
And then what dosage is that?
I don't know. I take one of the capsules.
Okay. All right. And then I'm going to ask you a little bit about your past medical history.
Okay.
And we'll come back around. Do you have any allergies to medications?
No, I don't.
Do you have any allergies to any animals, foods?
Nope, I don't have any food or animal allergies.
Okay. And then what health maintenance practices do you have, like physical activity, hanging out with friends? What do you normally do during the week?
I like to run, so I run on average 4 or 5 times a week.
Wow.
For about 30 or 45 minutes.
Mm-hmm. And do you feel like that helps you with your stress level, or why do you run?
Yes, for stress. Yep, I feel like it kind of helps decompress every day in the evenings after work, and kind of helps me, get on to the next day and relieves a lot of stress.
It's good that you have something to do afterwards. And then, do you have any health history, any asthma, diabetes, hypertension?
Nope. No diabetes in my family, and asthma. My brother has asthma, but it's not very bad. But he's the only one in my family that I know of that has it.
Okay, but you don't have any. You don't take medications for anything.
No.
Okay. And then, are you updated on your immunizations?
I am. Yeah, I got a flu shot this couple months ago, and I do that every year. And then all my other immunizations, I'm fully up to date.
Is that through work?
It is. Yep.
Okay. And then, as a child, did you receive all your immunizations?
Mm-hmm.
And any illnesses as a child? Any like measles, mumps, chicken pox?
I had chicken pox when
Okay.
I was, I think, first grade or so. Kind of just like everybody else back then, but had chicken pox.
Okay. Any other childhood illnesses?
No.
Okay. And then, have you ever been hospitalized for any reason?
No, I haven't. I've broken a bone in my foot, but that's really been fortunate, been very healthy, so I've never been hospitalized.
Any surgeries?
Nope. No surgeries.
Any blood transfusions?
Nope.
Okay. And then no injuries or illnesses?
Nope.
Okay. I'm going to go into your social history. Do you drink alcohol?
Yeah, I do. I'd probably say I would drink 4 or 5 times a week. I usually drink a glass of wine or a beer at dinner.
Okay.
And then probably once a week I'll go drink socially with friends for a happy hour or for a football game.
How many drinks do you think you have?
For socially, I would say 2 to 3.
And what's your drink of choice?
Beer or wine.
Okay. Do you smoke cigarettes?
I do not know.
Any illicit drug use?
Nope.
And And what is your like daily meals? Like, say you would describe breakfast, lunch, and dinner. What would your daily meals be?
For breakfast, I typically will eat a piece of fruit and granola or oatmeal in the morning, something quick because I head out the door for work. Lunch can be a little tricky. With what I do, we do a lot of lunch meetings, so we go out to lunch a lot. Try and eat salads and pick out the healthier things on the menu. But I will eat sandwiches occasionally too. And then for dinner, I try and cook at home most dinners. I try and do meats and vegetables, heavy on meats and vegetables. I've tried recently to cut back on carbs as well.
So it's pretty balanced meals. And then how would you cook your meals? Is it like sauteed, fried?
I try not to fry anything. I use the grill a lot, so grilled vegetables, grilled chicken, grilled steaks, and bake occasionally too.
And you said earlier that you run almost every day of the week?
Yep.
Okay, good. And then what do you do for a living?
I'm a project manager for a construction company, but I'm kind of on the project management side, so I deal with finances and schedule, and it's a desk job. It's a 9-to-5 desk job.
Okay, but you don't do any heavy lifting or anything like that?
I do not, no. I sit at a desk.
Okay. And then do you have any religious preferences?
I grew up Presbyterian, so I go to church every week, Presbyterian.
And do you feel safe at home? What is your living conditions?
Yeah, I live by myself in a house and feel very safe. Grew up in a safe family and great relationship with parents and siblings. And
good.
Yeah.
And then have you ever had any like mental health issues, any depression, or had like psychiatric aid at all?
No, I've never had any issues with depression, and it doesn't really run in my family that I know of. Nobody that in my family, immediate family, that has ever had serious depression issues. So.
Okay. And then I'm gonna jump into family history. Let's start with your mom. Has your mom had any cancers, any diabetes, hypertension, any health conditions that you know of?
No, growing up she had pretty bad allergies specifically to pets, but other than that, she had some seasonal allergies, but that's all she really has. She has no history of diabetes in her family, and she doesn't have it. Same with hypertension. So she
herself does not have high blood pressure?
No, she does not.
Okay, any high cholesterol?
On her side of the family, yes. So there is high cholesterol.
She does have high cholesterol?
Yeah.
Okay. And then any heart attacks, strokes in the past?
Nope.
And then for your dad, does he have high blood pressure?
No, he actually has low blood pressure,
okay.
Which actually kind of runs in the family. So he has low blood pressure. He also has high cholesterol.
Okay.
So both sides of my family have the concern of high cholesterol.
And any cancer in the family? Just your mom between your mom and your dad?
My father's side, there is a history of skin cancer.
So your dad's father had skin cancer?
Correct, yeah. So my dad regularly goes to a dermatologist, and myself as well as my brother and sister also go twice a year to get checked out, full head to toe, to make sure that there aren't any issues with that.
Have you noticed any skin abnormalities as of now, or?
No, not recently. Every now and then when I do go to the dermatologist, he'll find a spot that he zaps, for lack of a medical term, but yeah, and I see the importance of that too because of the history in the family.
Okay, and then so you were talking about your dad's family. Does his mom or dad have any other health issues like hypertension, high cholesterol, besides the cancer? Anything else that you can think of? Stroke?
Just high blood pressure from my grandmother, my father as well. So there is high cholesterol on that side of the family.
And high blood pressure?
Sorry, just cholesterol.
Just cholesterol, okay.
Blood pressure.
Okay. And then your mom's side as well, is there cancer, any health history you can think of?
Nope.
Okay. And then now we're gonna move on back to like you. I'm gonna just ask you questions about your symptoms. So let's start with your head. Do you have frequent headaches?
No, not frequent. Every now and then I'll have a headache, but nothing I wouldn't describe it as frequent. I'll take ibuprofen every now and then, and I'm fine.
When do the headaches usually occur?
It's a little random, but I think probably it has to do with dehydration. To be honest.
Okay. So are they at the end of the day?
Yeah, they tend to be towards the late afternoon or the evenings. Yeah.
Okay. And you said you take ibuprofen and they just kind of go away?
Yeah, it usually helps if I take ibuprofen, and I try and I'm not great about drinking enough water every day, so I try and make sure that I'm hydrated.
Okay, good. But do you have any concerns about your headaches?
Nope.
Okay. And then do you wear glasses?
I do not. Really don't have any issues with seeing my vision.
Have you ever seen an eye doctor before?
Yeah, when I was a kid, I actually had reading glasses for a while in elementary school, and kind of grew out of it, and I've got perfect vision now. So.
Okay. When was the last time you saw an eye doctor?
It's probably been about 2 years.
Okay. And then, do you ever have blurred vision?
Nope.
And then, do you have noticed any fullness in your ears, earaches?
Nope.
Do you have a buildup of any earwax?
Nope.
And then, have you noticed any nodules or anything in your neck? Anything abnormal?
I've not noticed
Any
anything.
trouble swallowing?
No.
And then, I'm going to ask you about your respiratory system. Do you have any wheezing or shortness of breath ever?
Mm-mm.
With activity, do you feel like you're short of breath?
No, I don't. No.
And then, do you ever have chest pain or palpitations?
No, I've never had any.
And then, as far as your GI is concerned, do you ever have diarrhea, constipation, abdominal pain?
No, I'm pretty regular, and I've not ever had any serious issues with that.
Any heartburn?
Occasionally, if I eat something really spicy, but I kind of know if I eat something that's spicy, I'll know. I get some heartburn.
Do you take anything for that?
I'll take a couple Tums, and that
Okay.
usually does the trick.
Okay. And this isn't a frequent problem, it's just when you have spicy foods?
Correct, yeah.
Okay. And then, do you ever have burning on urination or anything issues with using the restroom?
No.
Okay. And then, as far as neurologically, do you have any weaknesses on one side? Trouble walking, trouble with coordination?
Nope.
Trouble thinking of words?
Nope.
Okay. All right. Do you have any episodes of fainting?
Nope.
Okay. I think we're ready to go on to the physical exam.
Great. Well, thank you.